Well, good afternoon, everyone. Thank you so much for attending ONEgeneration's Health and Wellness Webinar Week. We've been going through each and every day, Monday, Tuesday, and today, just with some amazing speakers and topics. And we're just so grateful for you taking your time out today just to present and just to be present and to just interact with our presenters and just being involved. We really appreciate it. For those of you who do not know me, my name is Amby Cooper. I'm the director of ONEgeneration Senior Enrichment Center, and we're led by our organization's president and CEO, Jenna Haas. So just for the layout of this presentation, we'll have our presenter present first, and then we'll have question and answers at the end. But please feel free throughout the entire presentation to use the chat function box at the bottom part of your screen. There's also a Q&A box that you can use where if you want to ask a question anonymously, you can do that. And also, if you just feel comfortable just asking a question verbally, you can do that by selecting an option at the bottom part of the page that says raise hand. And then that will simply just allow you to verbally ask a question to our presenters. And this presentation is being recorded, which simply means that we're just able to, you're able to replay this over and over again. We're going to publish this on our ONEgeneration's newsletter. It will also be on our website, and we can just share it with your friends and your family and just create some really important conversations. And we can also get you signed up. If you don't automatically receive our newsletter, we can get you started today. So you can give our center a call at 818-705-2345. And I'm going to place that into the chat as well, and we can get you signed up. So I would love to go ahead and just introduce you to David London with Chronic Care Management Group and Dr. Payne. So today they will be presenting on a new topic of chronic care management for our seniors. So we are super duper excited to have both of you today, and they already have their screen shared with us, and go ahead and get started.
Well, good afternoon, everyone. My name is Dr. Brownell Payne. I'm a physician and who specializes in a couple things, interesting things. I'm an anesthesiologist, both pediatric and adult. I'm also a health information specialist, where I actually spend a lot of time dispensing health information for all age groups, in particular seniors. In addition to that, I'm also a general practitioner. I went to med school up in San Francisco, did a pediatric internship in Los Angeles, and also trained in anesthesia at UCLA. The bulk of my work now centers around health information and chronic care management for seniors. And the purpose of the session today is to give you some basic information about what is chronic care management. And you're asking yourself, well, chronic care, who has chronic care? Well, surveys have shown that the average senior over the age of 65 has anywhere between 6 to 8 chronic problems. And not everyone said, oh, no, not me. I'm super good. I'm healthy. But really, when you think about it, simple things like, which is really not simple, rheumatoid arthritis, aches and pains, low back pain, diabetes, hepatitis, hypertension, cholesterol, depression, alcoholism, all those things, benign prostatic hypertrophy for men, all those things fall under the category of chronic care. About 6 years ago, Medicare realized that we were losing a lot of seniors unnecessarily. So what they did 6 years ago, Medicare created a separate program, separate from your primary care doctor's program. They call this new program Chronic Care Management. And what it does, and normally most of us see our provider probably once every 3 to 4 months, maybe 3 or 4 times a year maximum. And let's say you see your primary care doctor in January, maybe again in April, May, maybe in the fall, and then maybe in the winter. He sees you then along with his other 3,000 patients as a primary care provider. The problem is what they found out was that there are things that happen between those office visits that increase the morbidity and mortality in seniors. Let's take, for instance, let's say you have high blood pressure, high cholesterol. Your primary care provider gives you medicines and checks your weight, and has a good interview with you in January. He sees you again in May. The problem occurs is what happens between that first and second visit. So what Medicare found out that they were having an increased mortality, which is increased death rate, increased emergency room visits, and also increased home health care. So all that not only was detrimental to the health care of the seniors, but also financially, it was overwhelming the Medicare system. So what they did 6 years ago, they created a separate program called chronic care management and separate funding. So you as a senior keep your primary care provider, but now there's another team that works with your primary care doctor and manage your chronic conditions in between the office visits. It's totally separate from the funding that your primary care doctor gets, which means you still can keep Dr. Rosen as your primary care doctor. But now there's another team that manage your problems in between visits. And it doesn't cost you anything, nor does it take away from the funding that your primary care doctor receives. So what does it take to be part of the chronic care management program that's created by Medicare? Very simple. You have to, number one, have what we call original Medicare. You remember your little red, white, and blue card you have that has your Medicare, so which means you need Medicare original, not Medicare HMO. For instance, people that have Kaiser, Scan, Humana, so they're not eligible for this program. Kaiser and Scan and Humana, they have their own chronic care programs. But in order to be eligible for this particular program, you need to have what we call original Medicare, which is Medicare A and B. It's Medi-Medi, which is Medicare and Medi-Cal. It can be Medicare with a supplement. For instance, I'm a senior and I have Medicare plus United Healthcare Insurance, a supplement. And there are a number of different supplements, Blue Shield, Blue Cross, a host of them has supplement. But in order to qualify for the chronic care management program, you need original Medicare. The second eligibility requirement is you need to have at least 2 chronic problems. And as I said earlier, it's not too I consider myself to be in great shape. I work out, etc., and I eat right and I work hard. However, I have rheumatoid arthritis. Those Writer brothers get me every day in my joints. So that's one problem I have. I take a statin to keep my cholesterol down. That's another problem. Okay. Suppose you have high blood pressure. Suppose you have type 2 diabetes. Maybe you're a little overweight. Maybe you have cataracts. Maybe you have, as a man, you have benign prostatic hypertrophy. Maybe you have erectile dysfunction. There's about 65 different chronic conditions that seniors have that qualify you for this new program. You only need 2. Now, if you live out in a rural area, way rural, it's only 1. But if you live in the areas that, particularly in LA County and their surrounding counties, you need 2 chronic problems, which is really not difficult at all to have those problems. Now, how does this program work in terms of how we take care of you? This program that we have gotten into, we have partnered up with a national company called Care Harmony, okay? And they have nurses and PAs and nurse practitioners. And what we do, this program does not require you to go to a location and see a doctor or a nurse or a practitioner face to face. This is all done on a website and by phone. In other words, at the beginning of the month, our team, which is consists of nurses and PAs and doctors, and we normally limit each nurse or each spot having no more than 225 or 200 patients with that particular nurse. So every month, the nurse brings up your name on the website and looks at your problems and then creates a plan, a clinical plan for the month to take care of your problems. Okay. And that consists of actually sitting there planning out your clinical problems. And also, it may necessitate the nurse calling you and saying, Mrs. Jones, how are you feeling today compared to last week? You know, how's your weight? How's your blood pressure? Going through those things. And that might occur 4 or 5 times a month. And they go over all your problems. They also, and this is really important, they also look at some of the social service issues. Are you getting, are you being fed properly? Are you able to get to your appointments? Are you visiting your family? All those things are, they deal with those issues also, which is very important in terms of seniors and anyone. A lot of seniors live by themselves. Majority of seniors have children or grandchildren, but often they live way out of the area. So there's not visitors. There may be some issues involving how to pick up your medications, how to get food. Um, do you need other things? Well, chronic care management also handles all of those social service problems. Okay. And you can see some of those on the screen. We deal with all those hospice care, end of life care, family support, a whole bunch of things. Okay. We work with that. All those things are done on the website and in communication with you by phone, etc. Now, there are times when we may well elect to send a nurse out to your house and just spend a few minutes with you just to make sure you're okay. All this information is also available to your primary care physician. Yeah, if we decide, okay, we think Mrs. Jones needs some lab work, we know she had an A1C or blood sugar or the renal function was checked in January, but it's now March and something sounds a little funny. So we'll order lab work, lab will come by and do the lab work, or we'll send you to the lab. And then we'll take that information, digest it, and put it into the planning stage of your care. At the same time, we send that lab information to your primary care provider. So this is like a double-edged sword for you. You not only have the care of your primary care doctor that's been taking care of you for years, you now have a team, chronic care management, that's available 24/7 to help you with your problems. And oftentimes the primary care doctor is concerned that he might lose you as a patient. No, never. You keep your primary care doctor. You now have a whole additional team to help manage your problems. Now, suppose in a rare incident, your primary care doctor doesn't want you to be in this program, but you really want to be in the program. Well, the federal law says you can be in the program without the consent of your primary care doctor. And your primary care doctor has to make available your medical records. But that's the extreme case. The majority of primary care doctors, when they realize the super efficiency of this program and how it helps their patients, they cooperate with chronic care management in terms of getting you, the patient, in a much better position. So there's a lot of interconnected things that go on with chronic care management. You, the patient, your primary care provider, social services, your family, etc. And if you get to the point where you need additional care, like hospice care, and just to kind of reflect on that, hospice care doesn't always mean you're dying. It just it means you may well need some advanced care in your home. And there are a tremendous amount of people that go on hospice care and then get off hospice care and resume what they were doing before. But the availability of hospice care through this program works well and is paid for. We also make available things like blood pressure cuffs, You know, a lot of you have probably heard of cardiomobile, which takes a EKG of you by just your putting your fingers on a little object, and then it gives us back EKG reading, scales, a host of things that are available for you to monitor your healthcare at home. This program is probably underutilized in Los Angeles because the vast number of people, and your primary care physician really doesn't have the time to do chronic care management. He may well have 2, 3, 4, 5,000 primary care patients. His efforts are spent on your primary care. So he doesn't do chronic care management along with primary care. It's just too overwhelming, particularly now that we have so many people and our senior age is increasing. People are living longer, but the quality of life is lessening. So what chronic care management does, it improves your quality of care. Is there another? Okay. I want to kind of go over a story of one of our clients, Diana, who, if you look at the screen, you could see her background. She was a widower. You know, she lives alone. She has a number of conditions, particularly diabetes, hypertension, asthma, COPD, and those are 4 common conditions. And there's probably 5 or 6 others that she has related to those 4. Okay, so she had some significant barriers of concern. You know, her income was low. She had she really had not seen her doctors on a regular basis. She didn't understand what was going on. She had some home environmental problems, and she had some awesome financial stress as well. We came in there along with Care Harmony, our clinical team, and really began to deal with each one of those problems till she got to the point where her diabetes, which was really her main concern, and diabetes alone leads to a host of other problems. So on a monthly basis, we began to tackle her chronic problems and also her environmental problems. We fixed the roof of her home. We got all that paid for. We worked with some of the community-based organizations in the field to deal with some of her problems. You'll be surprised how many seniors are underfed. You'll be surprised at how many seniors, particularly in the hot weather, become dehydrated. And you might say, oh, I know when I'm dehydrated. That's really not the case. As seniors, we are not aware at times that we're dehydrated. You know, the sensitivity to dehydration is not there as a senior. And it used to be, obviously, you know, you look at your urine, it looks dark, or you're having low urine output, et cetera. And people could tell by that. But as we get older, we're less sensitive to the fact we might be underhydrated. So that needs to be checked on. I'm a victim of dehydration. I'm a senior, and I was working in a project last weekend for Juneteenth with seniors, and I started at 6 in the morning, and I was running from here to there, setting up. And about 4 or 5 hours later, I had realized that I had really not taken enough fluids. I felt dizzy. And I really had difficulty standing on my feet. Now, I'm a skilled physician, an experienced physician. I always talk about dehydration, and I totally let it get the best of me. Luckily, some of my team members and my family noticed that that I had some signs of dehydration, and we took care of it. But suppose you're living by yourself. Suppose it's a typical day in the valley where it's 105 degrees in July or August, and there's poor ventilation, or you're not getting enough fluids. Well, that's just one of the things that can happen to you as a senior. And we review this with your chronic care management nurse. This is a very easy program. We on the screen you see our informational card that we give out. We have, you have the 8181. Okay, so what you see on the screen is the card related to our LA office. we have a specific, phone number for the Valley that has an 818 number, an informational card. And we have a director who manages our program in the Valley called Mrs. Naomi Bengat, who lives in Woodland Hills. And we have 3 or 4 other enrollers and workers who live in Van Nuys, Cedar, a host of other locations, Chadsworth, Simi Valley, in the Valley area that are experts with this program. And is it possible to flash the phone number or dial in the phone number at the end of the Valley unit where you can get additional information? And if you need someone to talk to you further that lives in the Valley, that has an office in the Valley, you can call the particular number that we're going to give you at the end. Okay. Um, I, I'm kind of verbose. I enjoy talking, particularly when it comes to senior problems and senior care. I'm going to open up the questions, but before I do that, something happened last week that I want to share with people that's really important. We were doing some testing at a facility, at a senior care facility, independent living facility. And we tested a married couple that was 75 years of age, and they had been vaccinated 3 months ago. So we routinely check for antibody levels. Now, this is not the swab test. The swab test that goes in your nose will give you, it will tell you if you have COVID or not. But the antibody level, which just you get that with the little teeny prick of blood, gives you your antibody level within 10 to 15 minutes. We tested this couple that had been vaccinated 3 months ago, and both of them had no antibodies. Whoa. Now, is that related to the test itself? I mean, the vaccination? No. What it's related to, as seniors, as we get older, our immune system is not as effective as younger people. And as we all know, most of your vaccinations are 96 to 97% effective against COVID. Or suppose you're not 3%. Or suppose your immune system is so busy fighting off type 2 diabetes in your body, the flu, hypertension, asthma, COPD, all those diseases cause inflammation. And your immune system is working overtime to take care of those other comorbidities that have inflammatory reactions. So your effort and work of the immune system is focused on that. This particular couple, and I looked at my exam, they looked healthy. I mean, they weren't in any distress. They didn't have COVID, but they had no antibodies for the COVID vaccination in their system. So, we're going to test them again, and then we're probably going to give them a vaccination. But in the meantime, we caution them about being around people that were not vaccinated, particularly young children, and being very, very careful. And if they become symptomatic, see the doctor. We're going to be testing them every month. My advice to everyone, not just seniors, but everyone, is every 1 to 2 months for you to get an antibody COVID-19 test. Real simple, takes 10 minutes to get the results, a little prick on your finger that you don't even feel. They can test your antibody levels and they can tell if you have an appropriate antibody level to counteract COVID. I get mine every month. Just had one 3 days ago, and my antibody, which is IgG, was high for COVID. So I'm set. I'm ready to go. I had my whole family tested. So that's just a word to the wise. What I want to do now is open up for any questions that you might have involving the chronic care management program, or any questions about any healthcare issue. I might be able to help you. If I can't help you, I certainly can refer you. Any questions?
Dr. Payne, I actually have a question that we've received quite a lot at the center. And it's just in regards to them receiving the COVID vaccine,
Yes.
and they don't necessarily feel comfortable being around other seniors, maybe, or any age range that does not have the vaccine. So what would you say just to them that, them coming, of course, coming back to the center and or just being out with family members, or just people that don't necessarily have the vaccine yet? What would you say to
Well, I think that's an important question. I think it's incumbent on, let's take family members. If there's a family member that has not been vaccinated, that family member should wear masks and utilize social distancing. But and it would be incumbent upon those non-vaccinated family members to keep their distance, particularly from the senior members in their family. It's I work at a couple surgery centers on a regular basis, and legally, you can't demand a person get a vaccination, but you can say, if you are not vaccinated, you can't work here because we deal with seniors and other people. So my advice to family members is families hang out. And as time goes on, we hang out more and more and more. But everyone in the family knows who's been vaccinated. And it's a responsibility of the unvaccinated people to wear a mask, keep their social distancing. And I would feel very uncomfortable if those vaccinated young children start hugging grandma and grandpa and Uncle Harry. It's going to create a problem. And now, majority of grandmas and grandpas and Uncle Harrys, they're vaccinated and they have adequate antibody levels. So they're covered. But still, you have to ask yourself, why isn't Petey, who's 14 years old, or Sonia, who's 17 years old, or some of the kids in school who can get vaccinated, why aren't they vaccinated? And if they're not vaccinated, why are they hanging around the older family members? That's like asking for problems, okay? But now when you're vaccinated and you're at the senior citizen complex, and I would assume that most seniors that go to ONEgeneration, other complex, are vaccinated. Now, we can't stop everyone on the street and demand a vaccination card, but we can ask people, if you're not vaccinated, wear a mask and really establish appropriate distance. So I would be concerned if I'm a senior, or if I'm 40 years old, because they can be affected. Over the last year and a half, I have pronounced 175 people dead because of COVID-19. And there are a couple of nights a week I work at a long-term health facility, Kindred, and we see a tremendous amount of post-COVID patients, and they're really headed in a downward spiral. And I'm very sensitive because I hate to see that. So many of those deaths could have been prevented if people were vaccinated. The new strain that's coming from India and other places, this new strain is virulent. It's very contagious. However, the vaccination is just as effective with the new strains as it is with the old strains. So if you're vaccinated, you're protected, well protected against the new strains. Does that help?
It
Hello?
does. It does.
Okay.
Thank you. So everyone, we do have the chat box at the very bottom of your screen. We also have the Q&A box, and you're able to raise your hand where you can verbally ask Dr. Payne a question.